masks in general are not going to be helpful. However, if you are taking care of somebody and need a lot of close contact with that individual, like a very small child or somebody who in fact needs help positioning themselves and is going to be and is quite symptomatic and coughing and sneezing around you, you want to limit your contact, but to the degree the contact is necessary, wearing a surgical mask or an N95 mask could be helpful in reducing your risk. If you have flu symptoms, don't go to work. Don't send your child to school. And don't go to public places like malls or theaters or other public events until at least 24 hours after the fever has gone below 100 degrees and Fahrenheit when not taking any medication. And keep drinking plenty of fluids. There are, however, situations when you definitely need to seek medical care and to seek it very, very quickly. And those are for children. If you have fast breathing or trouble breathing, if the skin color changes to blue or grayish, if they're not drinking enough fluids and have stopped urinating, if they're not waking up when you try and wake them or not interacting with you, being so irritable as a child that the child doesn't want to be held, or when the flu-like symptoms go away and then come back again with a fever, or if there is a fever with a rash. Those are the situations in children where you want to seek immediate medical attention. For adults, there are other situations you want to seek medical attention. If you have difficulty breathing, or you find you have shortness of breath, if you have pain or pressure in the chest or in the abdomen, if you have sudden dizziness, if you have confusion, or if you have severe or persistent vomiting. One of the aspects of this type of flu is that there's been more commonly vomiting and nausea and diarrhea than with some other forms of seasonal influenza. Like all seasonal influenza, this needs to be taken very seriously. And while it is true that this, on average, is simply like the other flus that we have this and other seasons, what's different is that for a small percentage of individuals who get it, particularly children, younger adults, pregnant women, and those with underlying problems like on cancer therapy or with respiratory or cardiac problems, they seem to be at higher risk than usual of serious complications. We've already had 57 deaths from H1N1 influenza since last April. And there have been 128 admissions to the intensive care unit within Los Angeles County. And that's why we strongly recommend that everybody get H1N1 vaccine, particularly those in the priority groups who should be first in line.